Initiative on Resistance Incidence Treatment Study. It is a patient-founded, patient-driven research partnership between the EGFR Resistors and Longevity Foundation. While the objectives are to understand the needs of our patients of over 1,600 in our community from 30-plus countries, identify areas for improvement, and give voice to patient concerns. While TKIs have proven to prolong patients' lives, the impact of an EGFR lung cancer diagnosis on patients' quality of life has not been well documented. We developed a 130-question longitudinal survey to gather information about diagnosis and treatment with a focus on quality of life, which is what I will talk about today. Lung cancer is a global disease, and therefore our survey is international. The survey was developed with input from patients, caregivers, clinicians, and regulators. Clinicians and regulators were included specifically because they are stakeholders of the data, and we want them to use this information. This is a comprehensive survey covering 3 different domains: demographics and risk factors, diagnostic and treatment journey, and the psychosocial impact, with the goal of identifying needs and areas for improvement. Because of time, I will only be able to provide a snapshot of the incredibly rich data we have. If anyone would like to learn more about the survey or have access to open source data, please reach out. The average age of diagnosis is young compared to the general lung cancer community, but consistent with previous studies in EGFR lung cancer. Active tobacco use is low compared to environmental exposure to tobacco, which is also consistent with previous studies. The likelihood of developing T790M after first-line treatment also shows that our patient group is similar to the general EGFR population, with those on afatinib first-line having a 2.5 times risk of developing T790M, and those on erlotinib having a 3.3 times chance. This is a snapshot of the treatment journey in both the patients living in the U.S. and outside the U.S. Here you can see a higher use of osimertinib in the U.S. compared to the other countries. Also of importance is treating brain metastases, which is a significant issue for EGFR patients, and this shows that too many are still receiving whole brain radiation with a higher rate outside of the U.S. On this slide, data for each year is the absolute number of respondents who reported using a specific therapy. There's a lot more data that I can't go into because of time, but you see a huge variation in prescribing preferences between the U.S. and other countries. This is probably due to approval and availability in other countries. This slide shows the most common side effects patients experienced, with green representing the severe side effects that needed urgent medical care to be managed. Diarrhea, nausea, and vomiting were among the side effects that were most severe for patients. About 63% of patients were hospitalized for a procedure related to their lung cancer or due to a symptom or side effect of treatment. Patients were hospitalized on the average of 2 times, and the average number of days spent in the hospital was 8 to 10. Almost all of the patients were hospitalized due to symptoms from the cancer or side effects of treatment, despite how healthy the people were otherwise. It's also important to note here that while TKIs are superior to other treatments for EGFR patients, there is still a large number that experience severe side effects that require hospitalization. One of the mental health questions on the survey was about depression. We found that 1 in 4 had clinical depression that was diagnosed by their doctor. Because this represents depression diagnosed by a doctor, it probably underestimates the number of lung cancer patients who actually suffer from clinical depression. Since 40 to 50% were diagnosed following their lung cancer diagnosis with a high number of suicidal thoughts, it is an area that desperately needs to be looked at more closely. Financial toxicity is real. 69% of patients said the cost of therapy was a major financial concern of receiving treatment. A subgroup analysis shows the difference in concern for patients in the US compared to other countries. In the US, the biggest concern was the cost of therapy, but in other countries, the concern was accessibility and availability of the treatment. In conclusion, Project Priority matches characteristics of the EGFR lung cancer community with different experiences between US and non-US patients. This is real-world data on the burden of hospitalization, depression, and financial toxicity that affects quality of life for EGFR lung cancer patients. It emphasizes the importance of patient-reported data and why it should complement clinical and research data. Only 5% of patients participate in clinical trials. So real-world data is a critical piece in understanding the true impact of an EGFR lung cancer diagnosis. I would like to dedicate this presentation to Anita and Terry, two of the co-founders of the EGFR resistors who recently passed away. They were the force behind creating the EGFR resistors community, and their guidance and efforts helped develop Project Priority. Thank you.